Hello everyone, my name is Olumide Phillips and I'll be talking to you on the topic of moral distress. To do justice with me on this topic are my group members, Laura Williams and Melanie Williams. So let's dive in on this topic right away. So what is moral distress in nursing? Moral distress in nursing is when a nurse knows what is the correct action to take, correct morally and ethically sound action to take, but is constrained by internal and external factors from taking that action. This creates ethical conflict, which then leads to anger, frustration, and fatigue for the nurse. The second phase of moral distress is even worse. This is when the ethical conflict is not resolved, then it leads to moral dilemma, which leaves behind a kind of moral residue of feeling stuck or having your back against the wall. That creates a sense of powerlessness, whereby you cannot do what you know is the correct and morally sound action to take, but rather you succumb and surrender to those factors that have constrained you. A good example is when there was a PPE shortage. During the period of PPE shortage, you will remember that most of us had to reuse the N95 and face shield, which of course we wouldn't have done on an ordinary day because it isn't the ethically correct action to take. Now, what factors in generality in the big picture makes a nurse susceptible to moral distress? We'll quickly look at this Venn diagram. Factors increasing susceptibility to moral distress will be internal constraints, external constraints, and clinical situations. Internal constraints in the sense, for example, when a nurse lacks the self-confidence to take an action. External constraints will be the hierarchical structure in existence that is constraining uh, the taking of decision, a final decision on an action that a nurse is trying to champion through the system. Because you have to go through several ladders and several people in the hierarchy before the final decision could be made on the action you want to take. So that's a constraint. Clinical situation creates constraints too, especially in our relationship with our patients. For example, when a patient is being given a false hope by a treatment team, and you are there as a nurse witnessing the whole false hope given, you feel morally distressed. That why should false hope be given to someone that should just be told the truth? So many things will constitute moral distress, but we'll find them under these three sub-headings. To continue to do justice to this topic will be my colleague Melanie Williams. Thank you and I appreciate your listening.
Thank you, Olu. I will be discussing moral distress in individuals and other team members within the organization that make decisions on patient care. So what are the symptoms of moral distress? Anger, sadness, relief, frustration, and anxiety, which takes a toll on all of us. Your moral integrity is compromised. So you see decreased self-worth, powerlessness, guilt, and self-blame. For the providers, it's not so much the patient deaths are the issue, but it's the fact that they feel unheard or they're inflicting pain without any benefit to the patient or they're unable to advocate for certain populations. For administrators, some of us may have experienced a provider who generates a lot of revenue and our times are able to make decisions that may or may not match the organization's core values. So for the administrators, unable to convince a governing board to decide, or they're unable to advocate for the staff due to cost. Healthcare leaders, which is us, managers having to sell a direction or decision that we ourselves don't necessarily believe in, or we're breaking our obligations to staff and our colleagues. In 2002, the Sarbanes-Oxley Act came about. It's a federal law requiring organizations to place greater emphasis on corporate responsibility, regulatory compliance, and ethics at all levels of management and governance. The law originally had applied to public-owned companies, but hospitals now have implemented this in their organization, so which is why we have things such as anonymous reporting. Healthy work environments leads to reduced bullying, harassment, and fear if they speak up. And just a side note, this law was created when the Enron situation happened at that time.
I am a bedside critical care nurse. We look after cardiac patients post-surgery, or if they've had an out-of-hospital arrest, then they come to us. I'm carrying out a project exploring moral distress in nursing. Higher levels of moral distress are related to burnout and compassion fatigue. Part of my research is about speaking to nurses about how we can better support them in clinical practice. We care for patients that are dying in intensive care. You know, you build an emotional connection to the patients and the families, and so obviously that's going to affect you when they die. I think what motivates me is seeing really great nurses struggling, and I just think we need to be there to support them. We need to put systems in place to support them, and I want to help great nurses stay great nurses, and I want to keep them in the profession because we need them for amazing patient care.
The nurse in the video says that her research is based on her desire to help great nurses stay great nurses. So how do we do that? Hemrick et al. Discussed 3 potential outcomes from moral distress, including becoming routinized to the issue and therefore missing the individual nuance of each case, conscientious objection or refusing tasks and responsibilities, and lastly, burnout, leaving the profession. We know fully present engagement in all aspects of patient care drives the success of overall care. We also know leadership must treat the issues of their employees on an ongoing basis and must actively participate in the solutions to the problems. Ethics at all levels of leadership, as Melanie mentioned earlier. Lastly, change happens over time, not overnight. So what are some approaches to action regarding employee retention and moral distress? First of all, communication. Moral distress is recognized and acknowledged. Supportive actions are put into place and promoted. All voices are heard regardless of employment level, and leadership actively participates. Education. Moral distress is still in its infancy as a concept, and details are emerging all the time. Therefore, it's really important to describe, discuss, and acknowledge the issue for better understanding. Environment. Team goals toward patient care so that there is a standard operating procedure. Adequate and appropriate staffing to patient needs from an objective point of view. And easy access to resources for employees. It's important to note that no one strategy exists to address moral distress. An institution's mission statement and core values should address the topic in language that makes employees feel safe, protected, and empowered to speak up should they feel they need to. Currently, only 2 national organizations have addressed this topic, the VA and the AACN. These are a few points from the AACN's position statement, and they include making sure there are institution-wide staff support systems, employee assistance programs, ethics consultants or individuals that you can refer to if you find yourself in an ethical dilemma, standard operating procedures for end-of-life care, ethics committees, and an emphasis toward employee self-care. Moral distress is a real experience that can happen to any healthcare provider at any level. The side effects increase over time and with repeated exposure. Therefore, it's very important to recognize the issue early to avoid some of the long-term effects that we discussed earlier in the slide deck. The role of leadership in acknowledging and addressing moral distress include awareness, training, support, focus, and modeling of behavior. If you're interested, please see our reference slide containing a link to a short 3-minute video from AACN's website on recognizing and overcoming moral distress. My name is Laura Williams. I'd like to thank my excellent team members, Olu and Melanie, and thank you all for watching our presentation.